Hello, guys. This is yet again another coronavirus update. Today is February 19th, 2020, here in Japan, and there are some things that we need to talk about. So, another 95 infection cases were confirmed in Japan. So, basically, like almost 100 in a day. That's very alarming. Um, 88 new cases were people aboard the quarantine cruise ship that's currently docked near Tokyo. Three men in Tokyo are among the new cases, and two of them are actually in serious condition. So I like to see what's going to happen with that. The three other infections were reported in the western prefecture of Wakayama. That seems to be where a lot of the domestic cases are going on right now. It's a very random prefecture, if you ask me. It's not really dense population wise, it's not home to too much tourism or anything. So it's very interesting that there are infections going on in Wakayama, and that's also further proof that there is a internal infections going on, and it's no longer China related or travel related or anything. And then another man in Aichi prefecture has also tested positive. So back to the Diamond Princess cruise ship passengers. While other countries such as the U.S., Canada, Hong Kong, and I believe Taiwan, I'm not sure, they have been chartering flights out of that hot mess for the last few days. But now they are letting passengers disembark. 14 days ago is when they decided to quarantine the ship, so the 14-day quarantine has passed. Raising concerns among health experts. This is what CNN is saying. Passengers who have tested negative for the novel coronavirus began disembarking from the Diamond cruise ship on Wednesday, so today, despite mounting evidence from infectious disease experts that they could unknowingly be carrying the virus back into their communities. Yes, that is actually very true, because there are some scientific evidence, and a lot of people are coming out and suggesting that this has an incubation period of 24 days. I've heard something like 40 days too, but I don't want to believe that just yet until I see some more scientific evidence on that. Japan's effort to institute quarantine measures aboard the Diamond Princess may have slowed transmission on land, but the disembarkation has sparked wider concerns, with some pointing to a potential breach of public safety. Yes, again, there could be people that are testing negative, they could be asymptomatic. We really don't know much about this virus right now, so I think that these people should still be closely monitored. I don't think that you should just let them roam free, and obviously you will probably see some cases related to this very soon, in the coming weeks, I believe. That is not far-fetched to assume. The U.S. Centers for Disease Control and Prevention commended Japan's quarantine measures, but they said they may not be sufficient to prevent transmission among individuals in the ship. Obviously, we have seen that ship has become a human petri dish. It is a good, solid scientific evidence of how transmissible this disease is. Like, for example, if some random dude on that ship, let's just say the coronavirus doesn't exist, and some random dude just happens to go on the ship and they had like the seasonal flu or something like that, you would not see as many people getting the flu from that one person. You wouldn't see that much transmission from one person, like you're saying with this coronavirus. So obviously we are dealing with something new, and I'm tired of people saying, oh, it's just a flu, it's just another, no, it's not. And this is showing that. So the health minister is saying, we want to ask the public to avoid non-urgent, non-essential gatherings. We want the elderly and those with pre-existing conditions to avoid crowded places. That is big. We're kind of seeing if you were following the coronavirus news going down in China before the quarantine, this was kind of what they were suggesting as well. So they are actually very concerned because they want the public to avoid non-urgent in gatherings, and if you have a problem, you shouldn't be going outside. So, like, reading along the lines, it sounds like they really don't want you to be going outside and trying and getting the virus if you don't need to. So yes, if you live in Japan, try not to go outside or try not to go to the mall or places of large congregation, obviously. But I've been doing that from day one. Kato, that's the health minister of Japan, says it will be difficult to track the source of infections. Japan could see a rise in cases. He stressed that it was important for medical facilities to prepare themselves in advance to tackle a potential spread of the infection in Japan. Well, I believe that is kind of too late, and obviously we are seeing the consequences of that because they weren't even fully capable of doing anything with the coronavirus ship offshore. They just kind of like let a bunch of people get infected with it, and I don't know who thought it was a good idea to quarantine people and keep people congregated in a ship for 14 days. That was very disastrous, and I don't understand why much of the international community is not saying much on that aspect. But whatever. NHK here says Japan prepares for widespread coronavirus outbreak. As cases of the coronavirus emerge around the country, Japanese health officials are finding it increasingly difficult to identify the routes of the infection. The government has announced it is stepping up screening efforts and will have the capacity to test 3,800 people a day starting on Tuesday. Okay, well, that's not really a lot of people. Japan is, I mean, yes, we have like a population decline problem, but it's not remote. So there are people all over the place, and I think they need to step their game up on that part. The health ministry official, yes, this is actually a big deal, and this is alarming a lot of Japanese people that I've been talking to as well. He was infected despite no close contact. So it says right here, worryingly, he was infected despite only working for about 10 minutes and maintaining a distance of at least 2 meters from the passenger. So that's also another suggestion of how transmissible the virus is. This is not the flu. I want to keep reiterating that because outside of people who've been following this and following the virology and the developments in this story, they always just like to downplay. I think I see it like on the government level too, but I see it in like the general population where I live. I live by a lot of Americans too, and they're just like, oh, well, it's just a flu. Like, no, because there's no vaccine for it, and 1 in 5 people, scientific evidence suggests, 1 in 5 people, it's like something like 17%, but 1 in 5 people is going to get in critical condition because of this. So it is not something to take lightly. Anxiety surrounding the virus has been palpable for weeks, with citizens throughout the country wearing face masks and carrying alcoholic disinfectant. Well, that's just normal Japan. Obviously, they do that because the flu season takes a big hold here. Schools close down sometimes when there's big outbreaks. So that's nothing new. But I'm pretty sure that there's an influenza season going on right now, and there's a coronavirus going on. It is not a good mix together. And imagine if you get both of those things together. I wonder how fucked you would be if you got both of them together. Pressure on the government grows. On Monday, the health ministry announced a directive instructing all municipalities to expand screenings to include people with symptoms who have not traveled to the Chinese provinces of Hubei and Zhejiang. Hubei is the center of the outbreak and has close business links with Zhejiang. So those are like the 2 epicenters that seem to be taking a hold in China. They're having a lot of cases. If you believe in the numbers that they're giving out, I believe they're strongly underestimated. But even given the numbers that they're giving out, it's still something to look out for and very concerning. So no travel ban still. Wow. Unbelievable. But okay. This was interesting. It comes to show that some people are growing concern, and I think it's following the same pattern as China has. As you've noticed that there was price gouging with China with certain commodities, and so here it says barefaced robbery. Thieves steal 6,000 hygiene masks in Japan, and this happened in a hospital in Kobe Prefecture. I haven't heard much about Kobe Prefecture in terms of the coronavirus, but if there's people there doing it, obviously the panic has spread to the rest of the country and people are growing concerned to the point that they're stealing masks at a hospital. But anyways, the 4 boxes containing face masks disappeared from a locked storage facility at the Japanese Red Cross hospital. Wow. The fact that surgical masks are locked, wow. That is really weird. Anyways, in the city of Kobe, hospital officials said on Tuesday, "We will have a large number of masks, enough to continue our daily operations. This is so deplorable." Well, you know what else is deplorable? The government action towards this. And if maybe they acted a little bit more responsibly, then we wouldn't have people stealing masks from fucking hospitals. But okay. Police have launched an investigation as they suspect that thieves intend to resell the masks. That could happen. I mean, I've seen it. There's a popular site called Mercari. It's like a Japanese eBay. Basically, people can sell their things, like a third-party Amazon type thing going on. It's astonishing at the prices that people are selling masks. But I mean, obviously, you're going to see that if there's a shortage, if there's no masks at the fucking store, the value of the masks goes up because there's no more. So obviously, this would happen with any other commodity. So you know how to fix that? You put more masks on the shelf. Hello, sorry about the interruption. I decided to go on mercari.com or .jp, sorry. And I was just looking around to see about this price gouging at the source. So we do have alcohol disinfectant being sold for 3,900 yen, so roughly around $40, depending on the yen rate. Masks, it looks like there is a total of 14 here, and they are coming out to a total of roughly around $25. And then here we have some more masks for around $85, and wow, one box of masks with 30. You will need to pay them around $53 for it. So that is insane that it is going on still, and I know the government was trying to crack down on it, but it doesn't seem to be working so bad. So in terms of the economy, again, yesterday I did mention that the economy seems to be on by a thread here. So Japan posts the biggest trade deficit in a year. The global economic slowdown has pushed Japan's trade deficit to its highest level in a year. So, as my videos are gaining more traction and a lot of interaction within people from throughout the world, I assume that there's an audience from Japan watching this. If you speak English, I would do some shopping right now, obviously. This is not looking good, even on the economic side. Whatever you want to say about the virus side, but the economic side is not looking good. So even the things that you love most, the things that you need, aside from preparing for the virus, like masks or all that type of stuff, you do need to be on the lookout for commodities, like things that we need to survive, like water and food and stuff like that. So I would buy, non-perishable goods, like I've been saying. Japan doesn't really have a lot of canned goods, I don't seem. But they do sell like Spam and stuff like that. That's interesting. Buy your rice before the inflation on them goes up, because I bet you that the rice prices will go skyrocketing. It happens a lot during natural disasters here in Japan. I mean, I lived here during the March 11th earthquake, and I've seen what a disaster can do to prices here. And then obviously, like I said in my last video, vegetables that we get from China seem to be on the decrease, obviously, because China's on a halt, but also with the indications that there is a trade deficit going on with Japan right now. So I would stock up on things before the inflation starts. It will start anytime, anywhere. I've seen a little bit of prices going up in terms of meat, because I like to buy my meat at the supermarkets. They're high quality, in my opinion. Those seem to be rising slowly. So, yeah, I see prices going up in a lot of parts. So I would buy as much as non-perishable goods as you can now before they place a limit on it. Buy your tea, buy your water. If you don't end up needing them in this situation, an earthquake can happen anytime, a tsunami, typhoon. Typhoon season is coming up too, so it is smart to have these things on hand anyway. And that's all I have to say about that. Buy your medicine. I went to the drugstore just to look, and there wasn't too much things available already. So I mean, if you can find it, if you can get your hands on stuff, then get your hands on it now. Toilet paper, I guess, is a big thing, so I would suggest buying toilet paper as well, as much as you can, because where I live, they're already placing limits on it, and I only have one confirmed case in my prefecture. So that's about all today. Make sure you like and subscribe and comment to have a discussion if you want. And I will see you guys tomorrow.